Session 1. What we learned in the previous session just is our simpler way or tour what we are going to learn in this module number 1. I will make the slideshow so that you can see, and we will send you all the books, all the slides, everything. You will get it. Those are registered students from the beginning. Session 1 training program of WNHO Institute of Sexology. It is a government recognized startup, helps to generate self-employment, affiliated to Indian Medical Association and International American College of Sexology, California, US. Module of PG Diploma, Fellowship, Masters, PhD. We already posted you the PDF form. Those who want books, hard copy, they can buy from Amazon. There are 4 books. One is Clinical Sexology. Second is Counseling, Ideal Relationship and Counseling. Third is various modules on diet prescription and shockwave therapy and number of things. PRP, P-shots and all 25 modules. We will go ahead where this is our where I am working as a senior consultant in sexual medicine, that is Aditya Birla Memorial Hospital, Pune. And these are the gadgets where we give the hands-on training at my center. It is not at Aditya Birla Memorial Hospital, it is at my center, WNHO clinic, that is WNHO Institute Center, where we will teach shockwave therapy, vacuum erection device, and TENS and EMS, utility and all. And stem cell therapy, P-shots, you can do the practically on the, you can observe, you can go ahead with the training program during hands-on training. I'm not taking much time regarding my introduction. Already you know, you have studied, you have done the research in the subject, because sexual medicine is such a branch where now in latest conference they discuss is the men's clinic. Under the men's clinic, because there is taboo in particularly if you write down the sexual medicine clinic, most of the time female patient get disturbed or male patient don't allow female to show you in OPD. This has happened with a very common complaint even from my patients. So about 32,000 patients on my register on my digital software, that is Fracto platform. You can see all the patients, how they are treated, various male sexual problems which include psychogenic cause, organic cause, vascular cause, patient and others, which include ED, PE, erectile dysfunction, premature ejaculation, low libido is very common, lack of desire, and counseling part, ideal relationship part, and number of things you will learn. If you take interest, you can learn lot of things, or you can use it and make your patient happy. I already covered basics in sexology. One thing you must remember, whenever patient reach to your clinic, don't say he's no sexual attraction. He may be sexual attraction. He may be heterosexual. He may be homosexuals. Heterosexuals are 80% in the society and 20% are homosexual, transgender group and bisexual group. So you have to diagnose it properly. Very important things. We taught you love map is very important. We will teach you during how to, when the patient comes to you, to evaluate their love map. You have to ask every patient, every case, whether she is a male or female. Ask how your first crush or love, attraction and romance started at what age and with whom, opposite sex or same sex or whatnot. What is in their mind? That all, if you find out, and you can understand that love, this patient is heterosexual, that is called straight, or homosexual, gay. Sometimes it may be confused, bisexuals, either male or female, they attract both. Some are transgender, where you know very well, genetic disorder. Their chromosome XY is a male chromosome, XX a female. If something is happened wrong, then extra Y or extra X attached, this goes to be as a transgender, and their mind may be of in this way. They are such confused mentality. That is called in our society chakka, in short, so that you can understand very well. And transgender surgery is also available. Those who are want to change their this sex and all, they can do it. And a number of movies are now had on this subject, and I have seen the Khuranas one movie, the transgenders and role and all, and they give the concept and ideas how they are and all. And homosexuals and gay, you must respect everyone, because everyone is a sexual. Every person is sexual. You have to respect their sex, either maybe heterosexual or homosexual or bisexual or transgender or any group. Now, my dear friend, we go ahead. Session 1 journey. What we covered in session 1: values in sexuality, anatomy and physiology, psychology of sexual response cycle, neural mechanism of sex, hormones in sex, sexual problem, history taking, physical examination and investigation. Everything is, most of the things you have learned in your medical curriculum during MBBS, during post graduation. The similar history taking is there, but certain changes in sexual medicine, just you have to know the law map, so that you can have gender identification, whether male is heterosexual, whether the patient is heterosexual or homosexual, or you have to find out their organs, and you can find out their absent of or tiny penile shaft in a male, or something change in a female, and accordingly you can diagnose transgender. You can diagnose and history taking and their interest. They say, even sometimes patient himself say, sir, I am a transgender, sir, I am a homo, sir, I am a bisexual. Now, after the pass the law in our these things in country, and the people are now openly comes at the big center like Pune, Mumbai. They said themselves, so easy to diagnose. Don't worry about that. Now, in session 1 is over. Session what we covered in session 2, that is counseling, psychotherapy, we will take in our next session, but you should know what we are covering. Sex therapy, various sex therapy, gadgets, shockwave therapy, then P-shots, PRP therapy, then TENS and EMS, meridian stimulation therapy, and so on, vacuum erection devices, and number of things we added. Even intracavaginal injection of papaverine and prostaglandin, bi-mix, tri-mix, quadra-mix available, and they can be used, but it is a temporary one. We want to be long-lasting results to the patient to improve their libido. That is a challenging nowadays. Patient want no medicine and they want cure, long-lasting cure. We are going to, that's why we added various therapeutic modalities, which includes yoga, which includes acupressure, which includes TCM, traditional Chinese medicine, which includes number of things, not along with the modern therapy. Then pharmacotherapy in details, coital postures is a very important. Sometimes patient comes to you, but they have the happy married life, but they can't conceive because of you have to evaluate their female partner whether the position of uterus. In the sonography, you can ask the patient to get the sonography done and find out the position of uterus. If it is normal, then it's okay. If it is a retroverted, then you must keep the pillow below the back of the female partner and have the coitus or intercourse. If it is a retroverted, then doggy pose, you have to ask the patient to do it so that they can conceive. Number of patients might conceive by these techniques or simple posture therapy. So you must remember each and every therapy is very important, and you will learn lot of things, because this is my 25 years experience I am giving you in various what I am doing to my patient. Whether you can use your own unique presentation or ideas during treatment, but you must know this should be added. So that is a multifaceted treatment, multi-therapeutic treatment. Then personality evaluation, also one of the unique things we are going to teach you, because it is very important to know whether whether the patient is extroverted or introverted, whether the patient is powerful, popular, peaceful, or perfect, how it affects their relationships, and how to correct it during advice and guidance and counseling. Now, session 3